Hello, my name is Reilly Scroggins. I am an Auburn University nurse practitioner student. Today I'll be performing a head-to-toe full physical assessment. This is my patient James. Before I came in the room, I've washed my hands. I've introduced myself to him. I've taken all of his vital signs, his height and weight. They are all within normal limits. As he walked in the room, I assessed his gait. It was normal with good balance. We're going to start out with a few questions. What year is it?
2020.
And who is the president?
Donald Trump.
Where are you at right now?
Doctor's office.
Okay. So he is alert and oriented ×3. His memory also appears to be intact. I'm going to have you close your eyes real quick for me. We're going to do a cyanosis test. I'm going to place an object in your hand and tell me what you feel.
Battery.
Good. Okay. Now, we are going to go ahead and test his reflexes. For the purpose of this video, I'm just going to do the reflexes on one side, but typically we would do it on both sides. So I'm going to start out with the brachioradialis, okay, the biceps, pull his hand here and do the triceps, good, the patellar, and the Achilles. All of his reflexes appear to be normal. So now I'm going to test his motor function. I'm going to place my finger here. I'm going to have you take your finger and touch your nose, then touch my finger back and forth. Good, and with the other finger. Good, so his motor function appears to be intact. Now we are going to go through all of the cranial nerves. We're going to start out with cranial nerve 1. I'm going to have you close your eyes for me, and I'm going to have you tell me what you smell.
Vanilla.
Correct. So cranial nerve 1 is intact. For cranial nerve 2, before he came in, I would have had him do the Snellen chart visual acuity test in each eye, and it would be 20 out of 20 vision. Now we're going to do a peripheral eye test. I'm going to have you cover your right eye for me. I'm going to cover my left, and I'm going to hold my fingers out here. Just tell me whenever you see them first.
See him. Yep. See him.
Okay, now I'm going to have you cover your left eye, cover my right, and we'll do the same thing over here.
See him. See him. See him.
Okay, so cranial nerve 2 is intact. Now we're going to do cranial nerves 2 and 3. I'm just going to have you look straight forward. I'm going to be looking in his pupils. Okay, now I'm going to have you look at my pen light out here, and I want you just to follow it in. Okay, so his pupils are equal, round, reactive to light, and accommodate to distance. So cranial nerves 2 and 3 are intact. Now for cranial nerves 3, 4, and 6, we will look at his extraocular movements. I'm going to have you keep your head facing forward, and I want you just with your eyes to follow my pen light around, okay? Great. So his extraocular movements are all normal, so cranial nerves 3, 4, and 6 are all intact. For cranial nerve 5, I'm going to have you just clench your teeth for me. Okay, I'm going to feel here. I'm feeling for the temporal and masseter muscles. They are intact and normal. Now I'm also going to do a sharp or dull test. I'm going to have you close your eyes, and I want you to tell me if what you feel is sharp or dull.
Dull.
Yep.
Sharp. Sharp. Dull.
Good. So cranial nerve 5 is intact. For cranial nerve 7, I'm going to have you lift up your eyebrows for me, smile for me, frown, and puff out your cheeks. Okay, great. So cranial nerve 7 is intact. For cranial nerve 8, I am first going to do the whisper test. I'm going to just glued one of your ears, have you close your eyes, and repeat what I say.
Pink.
Other side.
Blue.
Okay, now also for cranial nerve 8, we are going to do the Rene and Weber test. The first one, I'm going to place this on top of your head. I want you to tell me which ear, if you hear it in one ear, or if you hear it in both.
Both ears.
Okay, so that is a normal lateralization test. And now I'm going to place this behind your ear on your bone. Tell me whenever you stop hearing it.
Okay. Okay.
So ear conduction is greater than bone conduction. That is a normal finding. Now we will go to cranial nerves 9 and 10. And I will have you open up your mouth for me. I'm going to be looking back at his uvula. I'll go ah. Okay, his uvula rises midline. I also would normally test his gag reflex. I'm not going to do that right now. For cranial nerve 11, I'm going to have you shrug your shoulders and head side to side. Good. Cranial nerve 11 is intact. Cranial nerve 12, I'm going to have you stick your tongue out and go side to side with it. Okay, cranial nerve 12 is also intact. Now I'm going to take a look at his skin overall. I'm going to be feeling it for temperature. I'm looking for any lesions, any masses. I'm going to also note if I see any tattoos or piercings. I do not see any on him. His skin appears to be warm, dry, and tacked. It is appropriate for ethnicity. I'm going to take a look at his fingernails here. I'm looking at the angle of his nails. I do not note any clubbing. They appear to be normal. I'm going to check his capillary refill. It is less than 2 seconds. That is a normal finding as well. I'll continue throughout the rest of the physical assessment at each point to be assessing his skin throughout. Now I'm also going to take a look at his head. I'm looking, inspecting for symmetry of his ears, his eyes, looking at his lips, his nose. I'm going to start palpating his head. Any tenderness?
No.
Okay, so I'm assessing for tenderness. I'm assessing for any masses. Looking in his hair for any kind of infestations. I do not see any. I'm feeling his hair. Looking at the distribution, it feels soft, normal. Okay. Now I'm going to palpate his sinuses. We're looking at the maxillary and frontal sinuses. Any tenderness there?
No.
So I'll be palpating for any swelling, asking him about any tenderness, looking at any redness or warmth as well. Now I'm going to go ahead and look at the lymph nodes. I'm palpating the pre-auricular, the post-auricular, the tonsillar, the submandibular, the submental, the cervical, and the supraclavicular. And here I am palpating the lymph nodes to see if I can feel any swelling, to see if they're mobile, anything like that. I cannot palpate any of his lymph nodes, which is normal. Now I'm also going to go back here. I'm going to palpate his trachea, make sure it is midline. I'm gonna have you swallow for me. Okay, I was assessing there his thyroid gland. I did not note any masses of any kind. It appeared normal. Now I'm also going to feel his TMJ. If you go like this, open your mouth. Okay, no popping noted. Is it painful at all? Okay, so that is a normal finding as well. Now we are going to look in your eyes. First I'm going to do a cover test with you. Just look straight forward at me. I'm just looking at his eyes here. The cover uncover test. Okay, good. I'm going to close your eyes. I'm just going to kind of palpate. I'm palpating his lacrimal glands. I'm looking at his eyebrows. I'm looking for symmetry. Open your eyes again for me. And I'm looking at his conjunctiva. I'm looking at his iris, his pupils, cornea, everything. His membranes appear to be pink and moist, intact. Now I'm going to go ahead and do an ophthalmoscope exam. Just continue to look forward for me. Okay. Now look on this eye for the red reflex. Okay. So the red reflex is present in both eyes. I also am able to, visualize the fundus, the macula, the optic disc, and I would do a more thorough assessment on both eyes normally. Now I'm going to go ahead and look at his ears. I'm going to palpate them first. Look normal. I'm gonna grab a piece of my equipment that fell on the ground real quick. And I'm gonna go ahead and take a look in his ears. Okay. So the tympanic membrane was pearly gray. There was no bulges, no masses of any kind. I was able to visualize the cone of light, and there was a normal amount of earwax. No other discharge was noted. Now I'm going to go ahead and take a look at your nose. I'm going to occlude one nostril at a time. I want you to breathe in for me. Good. So both nares are patent. We're going to go ahead and take a look up there. Make sure our light's on. Okay, so the septum is midline. Both turbinates appear to be patent. The membranes are pink and moist. There's no drainage of any kind noted. Take a look in your mouth. Say ah. Okay, lift up your tongue for me. I'm gonna take a look at your teeth. I'm gonna look at your gums. Okay, close your mouth. I'm just gonna palpate his gums here. Lips are pink and moist. Buccal mucosa is pink and moist. The dentition is good. No cavities are noted. Everything appears to be in good condition. Now I'm going to take a look at his chest. I'm going to start in the back here. I'm just going to be palpating back here. Okay. I'm going to put my hands at the 10th rib. I'm going to have you take a good deep breath in and out for me. Okay, I'm checking for chest expansion. It is symmetrical. I'm going to percuss. Lung fields appear to be resonant, also normal. Now I'm going to take a listen back here to his lung sounds. Deep breath in and out. Now I'm going to check for cossovertebral tenderness. Tell me if this hurts. That hurt?
No.
Okay. Now I'm going to observe the front of the chest here. First, I would like to note that AP to lateral ratio is normal. The costal angle appears to be normal. For a normal physical exam, typically he would be in a gown, and I would have him undress to be able to visualize the chest better, but for the purposes of this video, he's going to leave his shirt on. I'm going to go ahead and just palpate here. I'm looking at this point for the point of maximal impulse. And I do feel it at his apical pulse. Okay. I'm going to palpate both carotid arteries here. Okay. And now I'm first going to take a listen to his lung sounds, and then we'll listen to his heart sounds. Good deep breaths in and out for me. Good. Okay, so his lung sounds are clear bilaterally. I did not note any adventitious breath sounds. Now I'm going to listen to his heart sounds, listening at the different points. First is aortic, pulmonic, Erb's point, tricuspid valve, and the mitral valve. I also would typically listen to heart sounds with both the diaphragm and the bell of the stethoscope. Ideally, I also would listen to him in 2 different positions, would have him lie down as well. Again, for this video, we're just going to do it in one position. I'm also going to take a listen to his carotid artery and see if I can hear any bruits. I did not hear any bruits. His heart sounds were all normal. S1, S2 was heard. No extra heart sounds, no murmurs were noted. Now we're going to take a look at all of his pulses. I'm going to check these bilaterally at the same time. Radial, ulnar, brachial. Typically would also check femoral pulses. Not going to do that in the video. Popliteal, dorsalis pedis, and posterior tibialis. And all of his pulses were noted to be 2+ bilaterally, so that is normal. I'm going to have you now go ahead and lay down for me. At this time, I'm going to assess for jugular vein distension. And now we are going to go on to the abdominal assessment. I'm going to lift his shirt up. First, I'm just going to inspect. I'm looking to see if his abdomen is round or flat. If it has any abnormal masses, it is flat. It appears normal, no masses of any kind. Do not see any pulsations. First, I'm going to take a listen in all 4 quadrants. So all 4 quadrants had active bowel sounds. That is normal. I'm going to listen to his aorta, see if I can hear a bruit. Okay, did not hear a bruit. Now I will percuss for the liver and the spleen. Okay, and now I will go on to light palpation. We are assessing for any masses here. We are assessing for any tenderness of any kind. Is it tender at all? Okay. I'm also going to be looking at his face, see if he's grimacing or if there's any guarding happening, showing that he might be in any pain. Once we do the light palpation, we'll move on to deep palpation. At this point, we are trying to see if we can palpate any organs. We're going to start over here on the right side, see if we can palpate the liver. I cannot feel it, which is normal. Do the same thing with the spleen over here. Again, I don't feel it. And then also we will check if we can palpate either kidney. And again, I cannot palpate the kidney, either kidney, and that is a normal finding. I'm going to have you go ahead and sit up for me. And we're going to do the musculoskeletal portion. For this, I'm just going to look at all of his joints. I'm going to palpate them. I'm trying to see if there's any edema. I'm looking to see if there's any redness of any kind. And as he moves them, I'll also be feeling if there's any crepitus, popping throughout any of the joints. Okay, so what I'm going to have you do first, your neck, just kind of roll your head around. Okay, I'm going to have you shrug your shoulders up against resistance. Okay, and down, good. I'm going to have you go like this with your elbows, extend and flex, good. And roll your wrists around. Okay, and now I'm going to have you put your arms out and flip them. Okay, good. I want you to squeeze my hands. Okay, and I want you to push against my hands. Good. So we're also testing the muscle strength of all the major muscle groups here as well. I'm going to have you push against my hands and pull against my hands and pull up your feet and push down. Okay, so we're checking there for plantar flexion, dorsiflexion. Everything appears to be normal. His range of motion for all of his joints are intact. His the muscle strength of all the major muscle groups are 5 out of 5. So all that's great. I'm gonna have you stand up now. We're gonna go walk over here. I'm gonna have you walk towards me, putting your heel to toe, heel to toe. Good, we're assessing for balance here. I'm gonna have you turn back around and walk your tiptoes. Perfect. And come back towards me. Oh, just a little bit. You're gonna put your feet together, close your eyes, and put your arms out to both sides. Okay, so we're checking here for the Romberg test, see if there's any swaying noticed, and there's not, so you're good. I'll come back towards me, face the wall for me, and bend over. And now, lastly, I'm just gonna check his spine. It's symmetric, it appears normal. Okay, you can stand up for me. And that will conclude our head to toe physical assessment.